Today, you're going to learn exactly what you need to do to set up a solid plan to regain shoulder movement. If you're new to this channel, I'm Tara. I'm a neurologic physical therapist, and on this channel, we talk about anything and everything related to mobility, health, fitness, wellness, mindset, in the context of neurologic rehabilitation. And today we are going to take the information from last week's video and apply it to your circumstances so that you will know how to build a home exercise program to regain shoulder movement. If you missed last week's video, in last week's video, we went over kind of the process of recovery, or how the arm typically regains movement after damage to the brain or the spinal cord, as well as I went in depth into some of the additional challenges that can interfere with normal movement if you have had damage to your brain or your spinal cord. If you've not watched that video, I highly recommend that you stop this video and you go back and you watch last week's video. I'll put a link for that video in the description below because it is definitely a necessary foundation of information to make this video make sense and to give you the exact tools that you need to build your own program. If you've already watched last week's video, hopefully you spent this past week kind of absorbing it and reflecting on it, and you have a better idea now of where you're at in the recovery process, as well as kind of a better idea of what some of those additional challenges might be, whether it be spasticity, a subluxation, or abnormal movement patterns that may be kind of things that we need to take into consideration when selecting the best exercises. So before we dive into the exact exercises, there is still a little bit more kind of behind the scenes understanding that needs to occur. First and foremost, it's really, really important, big picture, to understand that restoring arm movement is not just about this bone right here, the upper arm, the humerus bone, moving. Although that's what you might see, there are actually other bones that are involved that need to be able to move as well, and they are going to be part of kind of the exercises that we develop further on in this video. So in order to get this bone right here to move, there's movement that goes on at the thoracic spine, and there's movement that goes on that we can actually apply exercises to. There's movement that goes on at the shoulder blade, the scapula, that big flat bone on the back of the shoulder. That's an extremely important bone that we really need to pay special attention to when developing this shoulder program. And then in addition to understanding kind of the structures that are involved, it's also important to understand that in order to get these structures to move, it's not just about strengthening the muscles that attach to those bones, that pull on those bones, but it's also about any muscles that are shortened. I talked about that a little bit last week when I talked about contractures, but we do need to figure out, are there any muscles that are shortened that aren't lengthening enough, that are interfering with normal movement? And so all of that being said, I always recommend that when building this program to start with kind of mobility exercises, passive movement, some people call it, you might call them stretches, but to make sure that we have adequate motion in those bones before we actually go into the movement retraining. And so that's why this is going to be kind of divided up into two kind of segments: mobility, increasing the mobility or the movement of those bones, and then increasing the activity in the muscles that pull on those bones to get them to move in the direction that we want them to move. And then, of course, more importantly in this video compared to last week's video, is also taking into consideration not just shortened muscles, but I will term them kind of overactive muscles, or muscles that are firing that we don't really want firing. And the rationale or the reason why that's happening is either due to spasticity or an abnormal movement pattern. So how do we kind of inhibit overactive muscles, or muscles that we don't want firing, to help to achieve the necessary motions or movements of those bones? And this is kind of where most of you are at that watch this channel. Now, I didn't talk about spasticity and abnormal synergy patterns a whole lot in last week's video when I talked about like the early stage of recovery. And that's usually because these are things that usually occur or start to emerge later on, like several weeks out from that initial injury to your neurologic system. So they are going to play a more important role, I'm meaning spasticity and abnormal synergy patterns, when you are selecting the best exercises out of the laundry list of exercises that I'm going to give a little bit further on. So let's first just start with mobility. What motion needs to occur at the shoulder blade or the scapula, the thoracic spine, and that humerus bone? What motions do we need to make sure we have? So the two movements that we need to check for and make sure we have at the thoracic spine is extension and rotation. When it comes to the shoulder blade or the scapula movement, really the scapula needs to be able to move in all directions, and I'll get into what all of those are, depending on which direction you are moving this humerus bone. So again, this is just very simplified, big picture. You're not therapists, so you don't really need to go into what exactly is happening at the shoulder blade at this section of movement or that section of movement. So I'm not going to really get into that in a whole lot of depth, but the movements, big picture, that need to be able to occur at the shoulder blade are retraction, protraction, elevation, depression, upward rotation, downward rotation, posterior tilting, so the top of the shoulder blade actually tips backwards. And then what some refer to, and not everyone, so if you're a therapist, you might not agree with this term, but external rotation of the shoulder blade. So that's when kind of the outside border of the shoulder blade kind of tips backwards a little bit, or that inside border that's closer to the spine kind of tips forward or moves forward. Those are all the motions that are really necessary for normal arm movement, so normal humerus movement. And so what movements do you need at this arm bone? And now, again, right now I'm speaking very kind of a little bit more zoomed in. So if you don't really understand this little section, I'm going to go over here right now. That's okay. But there's big picture movement. Like if I was standing at a distance and I watched someone lift their arm, I would be able to tell you whether they were doing shoulder flexion or abduction or, reaching extension, reaching behind their back. But then there's also like little kind of like micro movements that occur right at the junction between the arm bone and the shoulder blade. So that's what I'm going to refer to here first. And that's, you need it to rotate. So it's a ball and socket. So you need it to externally rotate right at that joint. You need it to flex and abduct. And when I talk about all these motions, I'm talking kind of right at the junction where the arm bone meets the shoulder blade. But really critical in these little kind of zoomed in movements that I'm talking about is external rotation. Full mobility, full external rotation of that humerus, that arm bone in that cup is extremely important to get full overhead reaching. So I pretty much anytime I talk about the shoulder, I talk about stretching the arm towards external rotation, so stretching the muscles that rotate it in almost in every video because it's that important. So now back to that thoracic spine. What are some of the muscles that'll interfere with that extension? Remember, we're still in kind of the stretching stage or the range of motion phase. Are a lot of the neck muscles will really pull the thoracic spine into flexion and interfere with full extension. The ones that come to mind if you're a massage therapist or an athletic trainer or an exercise physiologist and you're working with someone that suffered a stroke, the scalenes are usually shortened, and it's really because of their angle of pull on the ribs. They just have a really good mechanical advantage to kind of pull that head forward and pull that thoracic spine into flexion. Of course, this SCM or the sternocleidomastoid, if you're a massage therapist and you're doing some manual work on someone that suffered a stroke. Also, again, it's just the angle of pull that it has on pulling that head forward and its attachments kind of on the sternum and the clavicle that also can interfere with thoracic extension. To a lesser degree, the pectoralis muscles, the abdominal muscles, really anything on the front of the chest or the front of the spine could be shortened and cause the thoracic spine to stay flexed and interfere with thoracic extension. Now, let's talk about the shoulder blade. So this is the next bone that we need to make sure that we have full mobility in. In particular, I'm going to really focus on reaching overhead forward for the most part throughout this video, because that's really the most important movement I think people need in order to wash your hair, reach into a cabinet, even reach forward into a cabinet, is really that shoulder or that arm coming forward or coming up over your head. So that's primarily what I'm going to focus on. So that scapula, that shoulder blade, that flat muscle on the back needs to be able to rotate upward, needs to be able to elevate, needs to be able to retract. It also has to be able to externally rotate, so the inside border needs to be able to go forward and the outside border needs to be able to come backwards, and it needs to be able to tilt backwards. So the top tip or the top part of the shoulder blade, the flat bone, needs to tip backwards. So if you wanted to visualize another way, the bottom part kind of goes forward. So if you were rolling a basketball back towards you, that's what we call posterior tilting. Now, the huge culprits or movements that most people I see, and this is really just based on my experience, I didn't look at any data or studies on this, most patients that I see that have suffered a stroke or a brain injury or have MS, the most problematic movements are that external rotation, so that inside border going forwards and the outside border coming backwards, and upward rotation and retraction. Those all seem to be limited for two reasons: tightness on the muscles that pull them in the opposite direction from those motions, and weakness in the muscles that kind of pull it in that direction, that attach to it kind of like a rope and pull it towards retraction, upward rotation, posterior tilting, and external rotation. All of those muscles are usually not very active. But as far as the shortened muscles or the weak muscles, the ones that are usually typically shortened and not allowing the shoulder blade to move are the bicep. So I'm going to keep bringing up spasticity and abnormal synergy patterns throughout this explanation. But if your arm flexes, that it's the bicep muscle, a shortened bicep muscle will also prevent that shoulder blade from rotating upwards, just based on where some of the bicep muscle attaches to that shoulder blade. Also usually shortened are the pec major, the pec minor, and the coracobrachialis. All really keep that shoulder blade bone pulled forward, and to a lesser degree, the latissimus. There are some fibers that do attach to the shoulder blade that will also cause that. So all those muscles are usually shortened, and so we need to make sure that we're stretching all those muscles. But more importantly, to keep it simple, you just want to move the bone in the direction that I mentioned, and then most likely you will stretch all the muscles that you need to stretch, or all the tight or shortened soft tissue structures. So don't get too overwhelmed. It's going to be really easy. You basically just want to make sure you have the movement in that direction. If you're a little more nerdy and you wanted to know what muscles might be involved, those, in my opinion, those are the biggest culprit. And then that arm bone, again, to get that external rotation, a lot of times the muscles that rotate that arm bone inward are shortened, and in this case, the latissimus, huge culprit. Subscapularis, huge culprit. Pec major, huge culprit. All of those need to be stretched out. But again, don't get overwhelmed with the muscles. You just want to make sure that you can do full external rotation. Now, the thing that is important is to know that there's multiple structures that are tight that pull that arm into internal rotation, and they're all angled at a little bit of a different angle in where they attach on that humerus bone and why they're kind of holding it down or holding it internally rotated. So, extremely simplified. Basically, you need to know that you have to be able to externally rotate your arm with your arm by your side, and you have to be able to externally rotate that arm bone with it abducted 90 degrees from your side. So it has to be able to rotate backwards in both of those directions. So just a little analogy for those of you that are in construction or building. If we're talking about the right arm, let's say you took your arm bone out and you put a drill in there in place of your arm bone, if you had that drill inserted into the right shoulder joint, the motion we're looking for is, now we're thinking that that drill bit is the arm bone. The motion we're looking for is counterclockwise rotation spinning if you go into the right arm, and if you put that drill bit into the left shoulder, that drill bit is drilling clockwise. So I don't know if that helps, but if some of you are builders or you're in construction, that might help you to visualize it a little bit. That drill bit is that arm bone. That's the motion we're looking for. Okay, so now you understand what motions need to occur. You understand a little bit more of kind of the culprits of the muscles that might be a little bit shortened. Now let's just talk about what stretches you need to do. And again, don't get overwhelmed by that. If you can really just focus mostly or mainly on the motion that you're looking for, that'll really help you to be able to select the best stretches if you know you're limited in any of those motions. I'm just going to kind of go through all of them because pretty much I highlighted all the things that are usually shortened or limited in motion. So again, just to recap, we need to make sure that the thoracic spine extends and rotates. So if your right arm is involved, you need it to be able to rotate to the right. We have to make sure that the shoulder blade rotates upward, retracts, tips posteriorly, and externally rotates. We need to make sure that humerus bone rotates externally. So those are all the stretches that we're going to focus on. And here's what that stretching program would look like, start to finish. Exercise tutorial, we're going to be going through a stretching routine with the goal of achieving arm reaching, in particular up overhead or past shoulder height. So we're going to go through that today. One thing you will notice in this series is that I use a lot of tools or props. And the reason I'm doing that is because in most cases, there's a lot of weakness in the arm due to hemiplegia, and you really have to have things to kind of hold other parts of that upper quadrant in place. I use an elbow immobilizer quite a bit because for a lot of people, it's hard to keep the elbow straight. And for some of the stretches we do, you really need to have that elbow straight. I also have my hands strapped to a lot of different things. That's also really critical because the forearm position is important for a lot of the stretches. So sometimes we want the hands to say palm facing up, sometimes palm facing down. And in any of those cases, if you have weakness in your arm, it's really hard to maintain those positions. So I do use a lot of tools and I highly recommend. They're usually pretty cheap and you can find most of them on Amazon. So now let's go ahead and dive into the stretching routine. So for this exercise, what we're doing is we're stretching out the front of the shoulder. We're going to do this in two different positions. Now you will notice I have the arm immobilizer on to keep the elbow straight. It is ideal for this stretch to have the arm straight, and in most cases, for those of you that are watching this tutorial, you can't keep your arm straight. So that's why I have this elbow immobilizer on. So we're stretching out the entire front side of this shoulder. So I'm going to do it with my arm directly out to the side like a T, and then up a little bit higher, more of like a Y position. So we're going to do this laying face down. You're going to use your opposite arm to kind of push your body, rotating it away from the arm a little bit to deepen the stretch on that arm. I always recommend that you roll over your uninvolved shoulder just for comfort. It'll be a little bit more comfortable when you're rolling from your back to your stomach if you do it over the uninvolved shoulder. Now you want to hold all these stretches a minimum of 30 to 60 seconds. And again, you're going to feel this all along the front of your shoulder. And then use your arm if you need to help move it into that Y position. And then using your uninvolved arm again, you're going to rotate away from that arm. Again, you're going to feel this all along the front of your shoulder. Hold it 30 to 60 seconds. And down. And again, hold it 30 to 60 seconds. So for this exercise, what we're doing is stretching out the front of the shoulder. Now the elbow does need to be bent for this one because what we're trying to do is externally rotate this arm and move it out to the side. So the best way for a lot of people to do this is just to do this one laying face down. You'll see other variations of this online, against the wall, things like that. But for those of you that have hemiplegia, it's really hard to hold your arm in those positions. So laying on your stomach is the best position to do this in. Again, you want your arm to be like kind of what we call like a W position. So you can see it's kind of shaped like a W when you are laying on your stomach. So that's a really critical component of this stretch. And then once you're laying on your stomach, you're going to use your opposite arm to kind of rotate your body. And then what that does is it kind of uses the table to actually help stretch that arm. So start laying on your side and then get yourself onto your stomach. You can use your other hand to kind of pull this arm, if this is the involved arm, kind of up to the side, so that it's in that W position. And then use your other arm to rotate your body. Again, it's really common also to have your kind of shoulders shrugged up towards your ears. So really make sure those shoulders are down and as far away from your ear as possible as you do that rotation. Then rotate back. And then again. Holding it 30 to 60 seconds. Rotate back. So for this exercise, what we're doing is we're trying to stretch that shoulder blade, that flat bone on the back, towards upward rotation, so everything that's pulling that shoulder blade down, and a little bit towards what we call external rotation. So for this exercise, the critical components are that you have to be laying on something, a towel roll will work, or something down the middle of your back to kind of what we say like float those shoulder blades so that they have the ability to move and stretch the structures that are pulling it forward. And then the setup is also very important. So I highly recommend having the elbow immobilizer on, especially if you have a lot of weakness in your arm, you're someone that has hemiplegia, and definitely hand strapped to a dowel rod with palms facing up, a little bit wider than shoulder width apart. Those are the critical components to really make sure that you're stretching those structures, again, that are pulling that shoulder blade forward and down. Remember, we need it to rotate upwards and we need it to kind of tilt or rotate backwards a little bit. So you really need those shoulder blades to be free, or kind of like what I call floating. So again, you're gonna keep those arms at that 45-degree angle, kind of out to the side just a little bit. Then you're gonna reach all the way back. Again, the important part is that those shoulder blades are floating so that they can move. They need to be able to rotate and move backwards just a little bit. And then hold that 30 to 60 seconds. And back down. What we're doing for this exercise, we're stretching everything really out on the outside of your body and trying to primarily stretch everything that pulls that shoulder blade down. So we're trying to work on restoring the ability to upward rotate that shoulder blade by stretching everything that's pulling it down. So there's a few different ways to do that. This is for anyone who doesn't have a whole lot of arm strength. It's an easier position to do this in because you can just use your body weight, and you want to be a little bit of distance away from whatever you choose to use to set your arm on. I don't recommend sitting on your bed. I highly recommend a mat table just because it is good to have a firm surface, especially for stretching. And then find something that you can set your elbow up on that's relatively soft, or something that you could pad the top of. And then you're just kind of dropping your body in towards whatever the surfaces that you have your elbow on, really just trying to stretch or elongate everything on that side. You can't see it, but your shoulder blade is kind of rotating upward for this, and you'll feel it. You'll feel a stretch all the way down the side of your body when you do this. And again, you just want to hold it 30 to 60 seconds. It actually should feel pretty good because on most of us, the muscles on the sides of our body are really tight. So it just kind of lengthens everything. And again, just holding it 30 to 60 seconds. So for this exercise, what we're doing is stretching external rotation. Remember what I said, very, very critical component of overhead reaching. You got to be able to externally rotate this arm after a stroke or a brain injury. Most of the time, a lot of the structures that keep that arm rotated inward are very tight. You'll notice I do this in several different positions. So you do want to do it with your elbow by your side. And then you slowly want to move that elbow out. That just stretches different muscles that are part of that tight system, that are all tight, that pull that arm inward and really limit overhead reaching. So again, you're going to rotate that arm externally, moving that elbow out. So doing it in a few different positions with the elbow. So again, elbow by the side. Using the cane to push that hand out, hold it 30 to 60 seconds. Move the elbow out to the side a little bit. Again, rotate it out. Hold that 30 to 60 seconds. Move the elbow out a little bit more. And again, rotate that out. And again, as high as you can go. Again, working that shoulder external rotation. So what we're doing here is a latissimus stretch. The key thing for this exercise is that you do have a strap around your elbows. You want your elbows to stay in, and you need something to keep your hands out. So I like a Pilates ring because it's really lightweight. If you have weakness in your hand, definitely strap your hand to the ring when you do this exercise, because you do want to be able to relax. And so if you have to think about holding on to something, it might be a little bit harder for you to relax. So strap around the elbows to keep the elbows in, something in your hands to keep your hands a little bit slightly further out. And then again, let me show that to you one more time. Once you're in that position, you're just really letting the arms fall over your head. And then you just want to hold it 30 to 60 seconds. Try and stay nice and relaxed. You might feel a stretch all the way down the side of your body for this one. And now, I know you guys are going to be some of you might be frustrated, some of you won't, because this is a lot of information. But I know I said this is going to be a 2-part series. It's actually going to be a 3-part series because I am doing such an in-depth discussion on helping you to understand what's going on, which I think is invaluable. So many of you say that you have run out of benefits or you don't have access to physical therapy anymore. Not that this is meant to replace physical therapy, but I really do want you to be able to critically think through your own impairments to come up with your own exercises. I'm going to end the video here. We're going to go on to the movement retraining component of this next week. So definitely come back for that video next week. Hopefully, though, that after doing all these stretches, you will be ready to go to start working on that movement retraining. If you're new to this channel and you haven't yet subscribed, definitely hit that subscribe button. Turn on that notification bell because that is the only way you're going to get notified when I upload new videos. I know some of you have seen some of my posts over the last couple of weeks, but if you are not following me on the new Instagram page, definitely go over to Instagram and start following Rehab HQ Global. That is the new page that is going to coincide with this channel. So you might have been following Orlando Neurotherapy, which is still good. There's still some posts there, but the majority of like the exercises and just touching base with you and giving you little tips throughout the week, that's going to be at Rehab HQ Global. So definitely go over to Instagram and follow us there. I hope that this was not overwhelming. I can't stress that enough. I hope you can just zoom out if you're getting a little bit overwhelmed and just look at the big picture, look at the main motions, and start doing those stretches. I enjoyed spending time with you all today, and I will see you in the next video.